So if I started doing TRT therapy, I know what steroids do to me because I've just stopped. Anytime a doctor ever prescribes it for whatever reason, I'm like I'm not allergic, but I just don't like it. If I did TRT therapy and I started getting those same results where I've got wanting to eat all the time, I'm getting hot night sweats, I can't sleep. What happens then? Can I just say, this is not working for me and just stop? Or
So you can do a couple things, and there are two different classes of steroids. There are anabolic steroids. Testosterone would fall into an anabolic steroid. And then there are corticosteroids. Corticosteroids meaning they are made down in the adrenal gland, like prednisone, solumedrol, decadron. The job of those is to decrease inflammation and try to help you knock your immune system down so that if you are fighting an illness, but your body is fighting a little too well to where it's causing problems like a sinus infection, where you are fighting so hard that you've got an overproduction of mucus and your sinuses have blown up and you can't breathe through your nose, you take a corticosteroid and it decreases the inflammation. You get bursitis because you've decided that you were going to take up pickleball at our age and you go play 50 days in a row without resting and your shoulder gets swollen. You get a shot of steroids in your shoulder. Those are steroids designed for decreasing inflammation or decreasing an immune response. Those are what were given so much during that COVID outbreak, trying to decrease the inflammation that happened in the lungs. That's what killed from COVID. The virus caused systemic inflammation and doctors could not figure out a quick enough way to decrease that inflammation. So corticosteroids and the side effects that you have from them are completely different from anabolic steroids like testosterone. Testosterone will actually increase your appetite in most cases. Most people, if they don't work out, will gain somewhere around 5 to 10 pounds in the first 6 months of starting testosterone on the male side. If you work out and you do what you are supposed to with your diet, a lot of times that's minimal. Even for the people that do have that weight gain over the first 6 months, if they don't work out, usually that weight starts to drop off because a lot of that weight is because an increase in water in the muscles, because the hope is the body picks up on this extra steroid that is in the system, this extra testosterone, and it thinks this muscle wants to work out, let's give it some water. Let's increase the blood flow to the muscle so that it can deliver more amino acids, so when you rip it up, it'll get repaired faster, and so that when you work out and the lactic acid builds up, it can pull it back out. So one of the big things with testosterone is your recovery time starts to decrease. It turns back that clock. That's the first thing that most people see. It's not you go into the gym and your bench goes from 200 to 300. It's you go into the gym and the next day that soreness isn't that I can't work out today soreness. It's just that I can tell I did something good soreness, and you're ready to work out again. So that repetition of being able to keep working out increases because our old man body gets superseded by the young man testosterone coursing through our veins.
Hey there, it's the Real Jason Duncan. Thank you for watching this video. We've got a couple other videos you might be interested in. There's one here and there's one here. But if you are an entrepreneur and you've ever thought about what it's going to be like when you get ready to exit your business, I'm the guy you want to follow. So make sure that you've subscribed to this channel and go check out the link in the description, therealjasonduncan.com. Check out the resources I've got for people just like you as an entrepreneur who's trying to get his life back, get her life back, get your time and freedom back. If that's what you want as an entrepreneur, if you're being trapped in your business, then I can help you get out of that. So go to therealjasonduncan.com. The link is in the description and check out one of these videos. I'll see you next time.